Somewhere around the middle of your pregnancy, your provider sends you for one specific scan. They call it the anatomy ultrasound. And from the way everyone talks about it, you can tell it matters more than the others. So you start to wonder, why this one? Why is this single ultrasound such a big deal? If that question has crossed your mind, you are not alone. It is one of the most common things parents ask before they arrive. And underneath that question is usually a quieter one. Is my baby okay? It is completely natural to feel your heart beat a little faster in that room, especially when it goes quiet and the person doing your scan is focused and silent. Many parents say the same thing, that the not knowing is the hardest part. That feeling makes sense. So let's take the mystery out of it and walk through exactly what this scan is and why it earns its reputation. Here is what is really happening. The smooth probe gliding over your belly sends out sound waves, far too high for you to hear. Picture them as tiny explorers sent out in pulses. They travel inward, bounce off your baby, and race back. The machine listens for those echoes and times them precisely, then turns them into the live picture on the screen. It is the same trick a bat uses to fly in the dark, or a submarine uses to map the seafloor, seeing by listening. Now here is why this particular scan matters so much. The person performing it isn't just taking a quick peek. Think of it as a whole house safety inspection. A good inspector doesn't glance through one window and call it done. They walk every room with a checklist. That is exactly what this exam is. Room by room, your care team checks your baby's growth and measurements, the brain and skull, the face and lips, the spine, the 4 chambers of the heart, the chest and stomach, the kidneys and bladder, and all the way down to the arms, legs, hands, and feet. Then they check the house around the baby too, where the placenta sits, the fluid surrounding the baby, the umbilical cord, and your cervix. That is why it takes longer and why your sonographer goes quiet. That silence is not bad news. It is concentration, the focus it takes to capture every precise image on the list. Along the way, let's clear up a few things people get wrong. Myth: this scan is just to find out the sex. Fact: that's a small, optional part. The real job is a complete medical check of how your baby is developing. Myth: ultrasound uses radiation, like an X-ray. Fact: it uses sound waves with no radiation at all. Myth: a normal scan means a perfectly healthy baby, guaranteed. Fact: it's deeply reassuring, but no scan can catch everything. Myth: you need a fancy 3D or 4D scan for it to count. Fact: standard 2-dimensional imaging is the medical gold standard. And myth: if they ask you to come back for a rescan, something must be wrong. Fact: a rescan is usually just because your baby was in an awkward position and a view needs to be finished. A few things help you walk in ready. Follow your facility's instructions about a full bladder. Some ask for one, some don't. Wear comfortable 2-piece clothing so your belly is easy to reach. Expect to be asked to shift position or even take a short walk to coax a stubborn baby into a better view. And bring your questions. Now, about the worry underneath all of this. Remember 2 things. Ultrasound has been used safely in pregnancy for decades. It's sound, not radiation. And your team follows a principle called as low as reasonably achievable, using only what's needed. And one more important distinction. This scan is a screening exam. Screening means a broad look that flags anything worth a closer inspection. It is not the same as a diagnosis. So if your team wants to take a closer look at something, that is them being thorough, not a verdict. So here is what to carry with you. First, this is a complete safety inspection of your baby's development, growth, organs, placenta, and fluid, not just a way to learn the sex. Second, it's a screening exam, so if anything needs a closer look, that follow-up is a sign of careful, thorough care, not bad news. And third, it's safe and reassuring. But no single scan is a guarantee, which is exactly why all of your prenatal care matters. If you have your anatomy scan coming up, and you're still feeling uneasy, ask your imaging facility and your provider what to expect for your specific exam, and write down any questions beforehand. This video is for general educational purposes only and does not replace personalized medical advice, diagnosis, or treatment from a qualified healthcare professional. Always follow the specific instructions provided by your ordering physician and your imaging facility.